My name is Demian Szyld. I'm the Associate Medical Director at the New York Simulation Center for the Health Sciences, and that's the simulation center that's located in Manhattan. It's a partnership between the City University of New York and NYU Langone Medical Center, and there we help faculty train learners from all walks of life, including paramedic students, nursing students, medical students, practicing clinicians, residents, and Grace and I are the lead faculty there, helping everyone pull off their programs, work with a great team. NYSIM is 25,000 square feet of simulation space, learning space. It's divided into three wings. There's the East Wing, which is a standardized patient center, the West Wing, which is a very flexible multidisciplinary space that can be a 5-bay ICU or an area for partial task training, disaster training, decontamination, CPR classes. And then the North Wing is our more traditional simulation plus control room. There we have 2 ORs, a labor and delivery suite, and a 2-bay trauma bay or PACU, depending on what we're doing there. The thing I really love is all about learning. What I really love is learning. So helping people learn, regardless of what it is that we're engaged in, whether it's clinical education or teamwork training, leadership. The thing that I teach the most these days is how to teach with simulation. So debriefing and scenario design, that's really what I really do the most. When I think about how to do that, for me, it's all about educational theory and brain science and what we can draw from those fields to make us smart and effective. When I think about us being effective in simulation education, it's really about behavior change. Just like in the clinical setting, when you want to do patient education, you're hoping that they go back and exercise or lose weight or stop smoking or take their medication. And for us, it's the same. When you come to a simulation course, we're hoping that when you get back to your clinical environment, to your school, to your ambulance, wherever you're working, that you're implementing what you learned, that you got some tools, pearls, some feedback about your performance so you can improve on where you are or sustain the good performance that you've exhibited in the simulation center. Well, this morning, Grace and I, the simulation leaders, were presented with a real authentic problem. That's kind of the same as when we put our learners in a simulation and they have to take care of a patient. Well, we had to take care of a risk management officer and an emergency medicine leader, and they had a big problem on their hands. So they had to work with their frontline staff to improve communication and help them basically have error-free medicine. Transfusion-related complications were rampant, and they said, "You sim guys, help us." So Grace and I were sitting there in the middle of the dark room and listened to them. They showed us a video of what actually happened to this patient in the field because her husband had his video phone out and recorded the whole scene, and she then got transferred to the ER where she had a postpartum hemorrhage. Thankfully, the baby did well. She had a postpartum hemorrhage and had to be resuscitated. We heard that there had been a transfusion reaction and some communication issues, and so Grace and I set off to work with the local leaders in the community, the ED leadership, the nursing leadership, the paramedic leadership, and also the techs, to get them to improve their teamwork. So that's how we puzzled around designing this course, and then on stage, they had to take care of the same patient who was had delivered and was bleeding out. We had a debriefing about that, and then transitioned to our presentation where we got to really unpack the elements of curriculum design, so the ADDIE model for curriculum design. It's great to get so many people together, the simulation community, the Northeast, all together in one place. It was great after our talk, people came over and said, well, I'm doing this and we're doing that, and can we talk to you about this? And it just seems like there's the right energy for collaboration here. We heard from Scott Arnold that there was about 60% nurses or from colleges and universities, and people from the pre-hospital environment, and that's just really great, getting people together to learn together. That's really what simulation is about. So Sun User Network is about simulation, so we're all on the same page. Of course, anybody who's doing anything in simulation is a partner with Laerdal, and we have a great close relationship with Laerdal, and we're one of the first centers to really use SimMom in depth and got the first couple of units in the nation. So we had a lot of experience there. Grace and I are really passionate about teaching and getting the word out about how to best use simulation. So it's a good partnership, and we're just really happy to be here.